I mean, and not to push you this way, but like one thing that I find is a fascinating topic that I would love to hear kind of some of your thoughts on is really kind of this relationship to pain. And because I guarantee you, myself included, that if I tried to do that, fist width, squat down to the back of my ankles.
Ask the heels,
yeah, ask the heels. I'm going to experience a lot of, pain and discomfort.
Well, the pain piece is interesting. Resting state of the human being is pain-free. Shouldn't have pain. Good article in the New York Times just came out like a week ago. Basically said that adults over 55 stop reporting pain to their physicians because it's like, oh yeah, I'm always in pain. And pain is one of those biomechanical markers that we know for pathology. Unrelenting pain at night is one of the things that I'm like screaming pathology, like cancer or something insidious, right? Really gnarly. But if you're moving poorly, your body's telling you something's wrong with your mechanics if you're in pain, and you should be pain-free. If you push on a tissue, if you lay on a ball, grab a kid's ball, grab a baseball, put it somewhere, it should not hurt to compression. Anywhere in your body, you should be able to put that ball and put a lot of compression on it. If your tissues are stiff, that's not normal. It feels like beef jerky. It should be like layers of warm silk sliding over steel springs. That's our analogy. Mm-hmm. That's how your body should work, but it's not. Right now we're sitting on our butts and compressing all these beautiful tissues, right? Just not normal. But if you push on something and it hurts, the tissue is stiff and telling you it's stiff because you've created a micro stretch underneath that compression. So one of the ways that we know that you're not normal is that it hurts the compression. So you should be pain free. Mm-hmm. And you can, if you move and something hurts, then that gives you information. It's testing 1 or 0, but you're getting immediate feedback that something's wrong. And the problem is we have zero baseline from which to work. Understanding what is just normal baseline movement of being a human, and B, not optimal, just baseline. Like I could do this, and you should be able to do it cold. Mm-hmm. You don't need to warm up and prep. Do kindergartners stretch before they sprint for the monkey bars? Hang on a second, I'm doing my dynamic leg swings. Like that's bullshit. That was the notion of supple leopard. Like a leopard attacks and defends at full physical capacity instantaneously. It's full leopard.
Sleeps 18 hours a day, and then it goes.
But if human beings, you should have that full physical capacity also, but we're not using it, so we lose it. Right? We don't know how compromised we are. You should be pain-free, and people should have a template for even taking a crack at their knee pain. If you have knee pain, you're like, what'd you do about it? They're like, I went and saw my doctor. I'm like, so you saw that your windshield wiper fluid was low, and so you went and saw your mechanic. And what did the mechanic say? Like, what the fuck is wrong with you? That, why didn't you add windshield wiper fluid? And the problem is we have just disempowered people for generations. We have no idea of how to even basically do the simple maintenance.
Right. No, and what would you say between kind of like what I would call chronic stable pain versus like an acute pain? Because I think it's a big thing that comes up in my practice where when somebody tells me that they have a joint that's in pain, or a part of their body that's in pain, I say, what happened? And if they don't have a story to me that's like, I was, kiteboarding and it kind of ripped my shoulder and now I'm in pain, I consider that kind of more of a chronic stable injury, correct?
No, I think that's wrong. I think that let me give you the examples that I sat in a surgery with a friend, John Wellborn, played in the NFL for 10 years. Mm-hmm. His knee looked like a garbage dump inside. Like a good garbage dump. Yeah. Like no ACL, moon rocks floating in the fluid, like stalagmites, stalactites, like literally like bloody cortical bone showing.
Yeah.
And bleeding into the joint space. Like the worst knee you can imagine, right? Just so gross. No knee pain. And what I think people forget is how robust the engineering is. Your iPad, you fracture and shatter the glass in the iPad still works. Mm-hmm. And that's what your body is. It doesn't work. It's a pain in the butt to negotiate that, But there's so much, if a horse gets a cold, you put the horse down, right? It's so touch and go. You lose a lung, you still climb Everest. True fact, right? That's actually been done.
You like this true fact thing?
True fact.
I like it.
It's my cause it's not a fact. It's a true fact. Big difference. And I think what we're seeing is, I think people have blown through their genetic inheritance, this tolerance for eating terribly for generations, for decades, and then all of a sudden being diabetic or moving a certain way because you're set up to be able to reproduce quick, and your body's got your back over and over and over and over again. And all of a sudden you've worn a hole in your kneecap, but you're 27 and a runner. And your physician's like, hey, you should maybe stop running. And you're like, you can't control me. You're the worst doctor ever. And the doctor is saying something so reasonable. She's saying, you've worn a hole in a bone that's designed to be 110 years old. Something's wrong. Mm-hmm. And I think pain is the same way. Sometimes we have people who have, bad arthritis, but I clean up their movement pattern. And a lot of times what people don't realize is, remember, that brain piece is that movement and pain are the same pathways in the brain. And I could be wrong, but I think it's the DCML pathway. Bust me. Dorsal columnar medial lemniscus. Man, I went to grad school.
I'll take it. I can't.
I could be wrong.
Got me.
But the problem is that
one acronym too much for two of us.
Someone will. The issue is that when you injure yourself, you shake it out, right? Because the movement blocks the pain. Yeah. And you can see this on YouTube. People get
absolutely.
hurt. People get hurt and they run away. Ow, ow, and then run, right? Because the running blocks the pain signal, right?
Well, it's like when I fucked up my thoracic spine, I had this doctor. I mean, there were a bunch of issues with him, but he worked with a bunch of hockey teams. Anyway, he started tapping my trap, and he's like, hey, can you feel your pain? And I was like, no, that's really interesting. And he's like, yeah, exactly. He's like, all right, so let me then proceed to prescribe you a bunch of fucking unnecessary temporary drugs. But it's amazing how much that movement or even palpitation masks pain.
That's right. And so what we know about with chronic pain people, I'm like, well, you have pain during the day? No, what happened? I laid down in bed. And at 1 a.m, woke up and my shoulder was throbbing. I'm like, well, what happened in bed? What happened was that you stopped moving and your brain got the full impact of your pain sensation.
Gotcha.
Right. So one of the aspects of this is, if movement and pain get mapped. So if something's going on painfully for over 2 months, over a month, it's a chronic pain state, chronic pain condition, and your brain starts to map the pain pathway with the movement motor pathway, and those become conjoined. So Yonda started talking about this, and one of the ways that we're able to help people get out of chronic pain is to give them a new motor program, i.e., you don't squat with your knees in. You move differently, and your brain recognizes. It's so sophisticated. If you continue the iPad analogy, if you need to know how the iPad swipes on and swipes off.
Right.
You don't need to know how the touchscreen interfaces with the software. That's already happening underneath.
Right.
You need to know how to turn things on and off. So if we can give people a brand new motor pathway, i.e., you squat a little more efficiently, maybe I get you off that hot piece of bone, and maybe I'll also put the needle down in a brand new motor pathway that is pain-free. And because that boded well for us. I mean, it's one of those survival instincts that if you're moving poorly, then your brain starts to remember, oh, you got injured this. Even though the noxious stimuli is gone, every time you move, you still get the pain sensation. Right? This is the chronic pain conundrum. And so what we do is we burn out people's nerve roots. Right? We do radio frequency ablation. We put them on.
What is radio frequency ablation?
They basically go in and
sounds intense.
And they fry out with radio frequencies, like radio waves. They burn the nerves of people's backs.
Oh, right.
And then they're on.
So you're just like, let's turn these off.
Let's turn them off. Let's pull the cords out. Because it's obvious we don't know how to help you. Remember, your physician, and remember, I'm at drinking wine with a physician. Your physician is on your side. And this is what people have forgotten. The physician is working to the best of their understanding.
However, they also have a defensive medical practice, oftentimes due to the litigious nature of the United States legal system, I would imagine.
Right.
I mean, maybe you can comment on this. It's just like, how much are physicians hamstrung from doing what they know is best because they fear some type of blowback?
You can answer that, but how is a physician supposed to treat you in 10 minutes or 15 minutes?
Well, right.
And you have carried your bullshit into the physician's office.
Right.
I don't sleep. I move like shit. I don't exercise. I'm stressed out. My knee hurts. Stop.
Right. Yeah. No, and I would say there's a trained cynicism that happens over time where you don't believe that people are going to be willing and open and empowered to change. And so you just end up like managing who they are. You know what I mean? And so like one of my big questions to you is basically like, is helping people to understand that there's a pain of injury and there's a pain of transition. You know what I mean? So when like one of your coaches, like, you know, Diane Foos, who I work with, you know, when she teaches me new moves or proper biomechanics, you know, 1 or 2 or 3 days later, I'm like, holy shit, you know, some of these muscles that I've never used properly before are
so
like
explain
really
Diane
talking to
Foos.
me.
So I'll let Justin give the outsiders insight.
Well, I mean, Diane Fu is an Olympic lifting, you know, subject material expert, and so she teaches me how
snatch,
to move,
clean and jerk,
and exercise.
Okay.
Diane's a coach at our gym.
Yes,
and is the best Olympic lifting thinking in the country right now, in the world right now.
She's very smart.
But also because she can coach kids up to elderly, and she knows how to scale up and down, and yet she's, you know, working to limits.